Apiani and Cassani and barbecue roll. Now remember, the Apiani and the Cassani are identical. Identical, okay? The only difference is Apiani is away, Cassani is the same. So let's do a Cassani of the right horizontal canal. I'm going to do a lateral. So unlike when I do the posterior canal, I don't have to support her head. Now I do. Because if I don't, we'll get lateral flexion. So I can do this by either squatting or I can use a stool. So bring your legs up. Now look where my elbow is. So if I do this, her little 8-pound head is going to become kind of heavy for me. Okay? But if I do this, it's much better. We're going to have a nystagmus. We're going to wait 1 minute. I'm then going to have her dump the debris into the utricle. I can cheat it a little bit by rotating her body like this. We're in Italy. No shaking, no baking, no tipping. No shake in Italy, no a shake, no a bake, no a tip. Okay? We're on the Via Veneto. Okay? Here we go. Unwrap, shift, come on up. No shake, no a bake, no a tip.
Do you keep her head looking?
Let her head come up normal. Don't worry about it. So, again, side lie. Wait 1 minute. Have her dump. Rotate her if you need to. Wait 1 minute. Unwrap. Shift. Don't lift. No a shake, no a bake, no a tip.
So that was a right ear Cassani, but a left ear
Apiani. Okay? Now, pros and cons. Cassani is a little bit easy to remember because you're treating the affected ear down like you do with everything else. However, when you put the person on the affected side with HC, the nystagmus and vertigo is intense. So, if the reason you're doing this is because they've migrated during a PC treatment and their nausea level is already climbing, okay, then, and they're telling you, I don't know how much more I can do, I'm feeling kind of, then I probably would do an Apiani and put them on their unaffected side because the vertigo will be less severe, less intense. Knowing full well that if there's a problem, okay, worst comes to worst, I'll go to do the Cassani. Let me also tell you something else that's kind of gross, but you're going to have to deal with it. You are going to have patients that will vomit. And they're more likely to vomit with a horizontal migration or following a horizontal canal treatment than with anything else, because you've already provoked them a number of times. Diaphoresis always precedes motion sickness, meaning if you start seeing that the patient is kind of getting wet and clammy and sweating, PP, potential puker. PP, potential puker. They don't know they're going to be sick, but they're going to be sick, probably. So what I will do is during the treatment, in every room we have an ice box with a freezer in it. And I simply tell the patient, you know what, it's a little warm in here. I get a chart or a magazine, I start fanning them. I said, you know what, you're a little warm. I'm going to put some ice on you to cool you down. Okay? I do not tell them that they are going to be sick. I do not tell them I have a wastebasket. But I know where the wastebasket is, and it's always got a liner in it. And the wastebasket is always going to be underneath the table where their head is going to end up. I've already managed it without ever telling them. So here's why. Wastebasket. Okay? All right. Good. Oh, is it strong? Okay. Okay, it's bad. Okay, let's take a dump. There we go. Okay, she's pretty hot. Okay, I've got the ice on her. Okay, how you doing? Pretty good. Not good? Okay. 0 to 5, how's your tummy? 0, fine, 5, not real bad.
5.
5, okay, dear, here's what you're gonna do. Slide a little bit towards me, okay? And she's gonna puke, and I'm gonna hold her until she's done puking. Okay? How you doing? Oh, I'm so embarrassed. This is terrible. This is awful. Don't worry. I got the chunky monkey all over my pants. Don't worry. Okay? Now, are you, okay, just lay here and relax. Are you comfortable?
Yeah.
I've got the ice on her. I'm just gonna let her lay there for 5, 10 minutes, 15 minutes. You okay?
Yeah.
All right, and then fine, unwrap, let's bring you up. Oh, I'm so embarrassed, and I'll have all the Kleenex, and I've wiped her and cleaned her, whatever. They're gonna puke. Once I can't suppress them, I can use peppermint oil, I can use alcohol, because remember, motion sickness is like Pandora's box. Once it's out, it's out. There's no way I'm gonna be able to put it back. So I wanna try to suppress it before it appears by using increased sensory integration. Contact, ice, but the other thing you don't wanna do is don't just lay on the person with your body. Your own body heat will make it worse. So you want additional proprioception, but especially some of it, like me, like my body, no matter what it is, it could be freezing out, my body is like hot, okay? So I've had people where I've got my hand on them or whatever, and they say, Dr. Gans, would you mind taking your hand off me? It is so hot. I just radiate heat. So I'll always have ice on them, okay? I'll always have ice on them, I'll fan them, but if we're gonna go, and there's nothing else for me to do. I can try to take little breaths. Okay, here's a little peppermint oil. Here's a little, okay, I've got the ice. Oh, this is it. Okay, and what? There's no point getting them up. So what are you going to do? You're going to sit them up to put their head back down in a bucket? You're right there. Just puke in the bucket. It's perfect.
Do you ask them to put, like, if you have if you know you have someone with horizontal canal and they have long hair, like, would you ask them to put their hair back before you position them? Like, if I go to throw up, I'm gonna have, like, hair everywhere too.
I will usually, just because I want to see what's going on, but because most of your patients are older, most older people don't have long hair, but sometimes they do. But yes, you set the stage so everything will go as smoothly as possible. You know all the stuff that can happen. They don't, okay? And you don't want to scare the bejesus out of them. So one of the things that I'll do, because anybody could have potentially a Tomarkin crisis, I don't say to them, oh, by the way, when I sit you up, you may feel like you're falling into hell. Okay? Because everybody be running out of the office, right? So what I say to them is, look when I sit you up, sometimes people will feel like they're sliding down a water slide or a laundry chute. Don't worry about it, I'm holding on to you. You see, you've told them what's going to happen, but not to the point where their anxiety level is going to be, right? So, pretty simple. So you've had a lot of experience now doing the side lying. That should be very easy for you. You can, again, do it like this, or if you're going to support the patient, if there was an older person, now instead of turning their head, do the same thing, but just like this. So you'll have a little bit of work to do here. But you see how easy that was? Fully supported. Dump. Roller if you need to. Okay? No a shake, no a bake, no a tip. Roma, Milano, Venezia, Firenze, Pisa. Okay? In Milan, we don't shake, we don't bake, we don't tip. Okay? All right, start your